In 1981, the world was introduced to a new, imminently lethal mystery disease that was killing gay men by the handful. And for the next 15 years, it held a nearly 100% mortality rate. Hysteria, fear-mongering, and blatant homophobia cultivated a brutal reality for those diagnosed with AIDS. That is, until one nurse at San Francisco General Hospital took the initiative to open an inpatient ward completely dedicated to giving compassion and dignity to the suffering. Welcome everyone to Sunflower Storytime with me, Kathleen, where we tell tales that celebrate the resiliency of the human spirit and leave us feeling hopeful and inspired. So gather around, scooch on in, and I'll tell you the tale of Ward 5B and the selfless, incredible people who were faced with a heartbreaking diagnosis and gave their patients a wonderful death. There's a lot of just completely devastating aspects to the AIDS epidemic. It was ugly from a medical standpoint. The disease itself was painful, life-sucking, and deadly. If that wasn't bad enough, it was all wrapped up in blatant, aggressive homophobia, which led to worse outcomes for people with AIDS and delayed research and treatment options. But this story is about the absolute best of humanity. In times of trouble, there's always helpers, as Mr. Rogers said. Look for the helpers. So, let's go back to the beginning. On June 5th, 1981, the CDC, Centers of Disease Control, published an article describing cases of a rare lung condition called pneumocystis carinii pneumonia, PCP, in 5 previously healthy gay men in Los Angeles. They also had a few other unusual infections, indicating that their immune systems were not functioning properly. 2 of the 5 died before publication. The following 3 died soon after. This is the first official reporting of what would be soon known as AIDS, acquired immunodeficiency syndrome. That same day, a dermatologist in New York City reports to the CDC a cluster of cases of Kaposi sarcoma, KS, in previously healthy gay men in New York and California. KS is a very rare and aggressive cancer linked to poor immunity. 3 days later, June 8, 1981, a CDC task force is set up to investigate these sudden and rapidly growing cases. A month later, in July, the Bay Area Reporter in San Francisco published an article dubbing the mystery illness as gay men's pneumonia. So far, every mention of this new disease is immediately labeled and tied to gay men. In December, Bobby Campbell comes public with his diagnosis, writes a newspaper column for the San Francisco Sentinel on his experience living with KS and what to look for, including pictures of the lesions. He's the first person to publicly come out admitting that he had AIDS. April of 1982, 10 months after the first reporting, the CDC estimates that over 10,000 people may have been affected. In 10 months, this is a rapidly growing concern. In May of 1982, the New York Times writes an article and publishes the term GRID, Gay-Related Immune Deficiency, deepening the idea that gay men are the only ones affected. June of 82, 1 year after the first reporting, the CDC makes the link that this is probably a virus that is sexually transmitted. September of 82, the CDC uses the term AIDS for the first time and gives a definition. A disease at least moderately predictive of a deficit in cell-mediated immunity occurring in a person with no known cause for diminished resistance to that disease. 4 days later, 2 congressmen introduced legislation to allocate funds for research into AIDS, and it dies in committee. Let's be clear, this has affected tens of thousands of people and popped up 15 months earlier. And no congressional or federal funds have been invested into doing anything about it at this point. December of 1982, just over 20 cases of infants dying of AIDS has been reported. All were found to have received blood transfusions in the first weeks of life, traced back to a donor with AIDS. Now, it is not just a gay men's disease. Kids are dying too. It also has been spreading in the IV drug use and sex worker populations as well. January 1st, 1983. Ward 86 opened at San Francisco General Hospital. It is the world's first outpatient clinic dedicated to treating patients with AIDS. Outpatient means seen for visits, not admitted to the hospital as a patient. March 4th, 1983. The CDC publishes that AIDS may be caused by an infectious agent that is transmitted through sexual intercourse or through inoculation exposure of blood or blood products, and issued recommendations for preventing transmission. May of 1983. Finally, Congress passes its first bill that includes specific funding for AIDS, $12 million allocated to the departments within the Department of Health and Human Services. It took almost 2 years after the first reporting for federal funding to be allocated. And then it wasn't until 85 and 86 that real funding came in the form of hundreds of millions of dollars. 5 years into the crisis. And this brings us to our main event today. July 25th of 1983, a nurse named Cliff Morrison opened Ward 5B at San Francisco General Hospital. It was the world's first dedicated inpatient unit for AIDS patients. It started as a 12-bed unit staffed on a volunteer basis. Nurses and other staff were not assigned to work 5B. They all very eagerly signed up. Some even demanded. One last timeline tidbit to mention. In September of 83, 2 months after this ward opened, the CDC officially declared that AIDS was transmitted through blood and sexual intercourse, and definitively ruled out transmission through casual contact, food, air, water, and environmental services. I know this because I read the publication in the CDC archives. It was very easy to find. But the hysteria and fear-mongering won. By this time, everyone, including medical professionals, were terrified to get anywhere close to someone with AIDS. According to Cliff Morrison, there was a real need to form a dedicated unit to AIDS patients. At first, he didn't like the idea because it felt kind of like a leper colony or a quarantine. He didn't want them to feel shunned and isolated. Until then, everyone admitted with a diagnosis was on regular units as anyone with an infectious disease or not would be. But he noticed that no one would go into their rooms. He would visit these patients and find that they weren't being bathed at all. Food trays were piled up outside their rooms because the staff were too afraid to touch used trays. And overall, they were being neglected. A dedicated unit then made sense. To have a staff that wanted to work with these patients and could overcome their fear of catching the disease so that they could be cared for. When Ward 5B opened, there was a pivotal change in the care provided to these patients. The healthcare workers touched them with their own hands. They offered hugs, held their hands when they couldn't breathe, and showed compassion and care through physical touch. Patients said that they were told by other nurses before being admitted to 5B, "I'm not touching him," even through gloves and full isolation gear. Some said that they hadn't felt the touch of another human in over a year. Once they got the diagnosis, everyone, literally everyone, was scared to touch them. Humans are wired to require physical contact. It must have destroyed them and felt beyond isolating to have everyone around you physically recoil from you. You can understand the fear to an extent. AIDS was a painful death, and no one knew how to treat it. There wasn't a cure. But eventually, they did know that it wasn't spread through casual contact. Educating the public and even educating and convincing hospital workers of that proved damn near impossible. In order to accept that you can't catch it, you have to put aside your own homophobia and personal biases. And personally, I don't think a lot of people were able to do that at the time. There is a documentary that I'm going to demand that you watch called 5B, and they interview nurses and doctors that worked on this ward and provide a lot of footage of the ward and the patients and what it was like. They said that in healthcare, there's typically a boundary between the provider and the patient. And this is meant to help protect the provider from being emotionally drained by what's going on with their patient. But on this ward, they were allowed and encouraged to love their patients. In the hospital setting, the objective is to heal the patient and help them get better. With AIDS, however, it had a 100% fatality rate. If someone fell ill with it, it was only a matter of time before they died. So the goal of 5B was not to heal them. It was to give them a life to live until they died, and to offer them a dignified and good death. There wasn't much they could do besides provide love from another human. It was kind of a specialized hospice unit. I really can't imagine the emotional toll that was taken on these nurses. Every patient that they meet, they had to say goodbye to, and probably pretty soon. And all of these patients were young, in their 20s, 30s, 40s. Hospice centers are typically filled with people of very advanced age, full-on geriatrics. In 1984, they had well over 100 patient deaths. That's every 2 to 3 days someone on their unit is dying. What other disease had a 100% fatality rate? A disease that diagnosis meant certain death. I'm truly in awe of how these medical professionals came to work every day. There's many mentions of the toll it did take on them, and that some had to turn to alcohol or drugs to keep on going, and I don't see how it couldn't. In the 1980s, medicine and hospitals were still pretty rigid with the idea of family visitation. It was only immediate family and for a certain number of hours each day. Cliff knew that this had to change. A lot of the gay men admitted to 5B didn't have immediate family that talked to them anymore, and a lot of their partners weren't technically family because they weren't allowed to be married. There were some parents visiting their sons in 5B, finding out on their deathbed that their son was gay. The patient got to decide who their family was and who they wanted to visit them. The entire atmosphere of 5B was about caring for the soul, the person. They couldn't cure them, but they could make them comfortable, nurture their relationship with their loved ones, share good food together, have unit parties, and give them their dignity. They brought life, laughter, and joy, and made it a wonderful place to go die. A story about the AIDS epidemic wouldn't be complete without mentioning the atrocious homophobia and violent discrimination that took place. People with a diagnosis would hide it from their employer, from their landlord, their health insurance company, everyone. There's countless accounts of people being fired, people being kicked out of their apartments, and their landlords burning their bed in the streets, houses being set on fire in response to someone's diagnosis. There was even a massive legal battle within San Francisco General Hospital itself. A group of nurses on other units thought that they should be able to wear full protective gear and limit their contact with AIDS patients, and it should be their right to do so. Cliff, as the assistant director of nursing and head of Ward 5B, spent years fighting against his own nursing staff. And at the end of the day, all of this concern was really just gift-wrapped homophobia. The outcome was in 5B's favor. That there was no cause for individual rights when donning extra equipment would be at the expense of providing the correct nursing care. A nurse working on 5B got a needle stick one night, was tested for HIV. By this time, they had isolated the HIV virus and had a blood test for it, and she came back positive. Thankfully, she didn't develop AIDS before the cure was developed in '96. But this caused a big public outcry and gave leverage to those nurses fighting against 5B because a nurse got infected. That nurse would go on to advocate for safer needle practices across medicine. Today, needles and sharp products are much safer to use than they were in the 80s. When the issue of the nation's blood supply being contaminated came up, it was too late for some. Many children who had hemophilia received blood transfusions and got AIDS as a result. Ryan White was a prominent teenager who was told he couldn't go to school anymore because the school was afraid he would infect the rest of the students, even though by this time it was proven not to be transmitted in any sort of casual contact. There were congressmen going on news interviews saying absolutely wild stuff, like maybe we should brand everyone with AIDS and put a tattoo on their forearm so that other men can see that they have it and not to have sex with them. There were even groups advocating for quarantining all gay men in camps. And it wasn't until 1987, 6 full years into the crisis, after 21,000 Americans had died, that the President of the United States, Ronald Reagan, first said the word AIDS publicly. He stated that they would invest more money into it, great, but they also might force all people trying to immigrate into the United States to test for it, and they would be denied entry if positive. And if that wasn't enough to get hate and discrimination from everywhere the gays looked, including their own elected officials, they couldn't even grieve the loss of their friends and family in peace. There were groups of people picketing the streets outside of churches where funeral services were being held, with signs saying very hateful things that I will not repeat. You have to wonder that if this horrendous disease chose another group to infect, if it wasn't in an already marginalized and discriminated against group, maybe something would have been done sooner. Maybe they would have thrown those hundreds of millions of dollars at the problem a full 5 years sooner than they did. It wasn't until 1996 that things changed. A real cure was developed, and for the first time, they were seeing their patients heal and get better. That is 15 years of just death. There is an entire generation of men lost to this disease. And those who survived came out scarred. Cliff, being a gay man himself, says he doesn't even have many friends his own age because most of them died. I am 31, the same age that Cliff was when he opened 5B. I can't imagine watching my friends and peers all dying. Even one friend dying would be devastating and life-changing, irrevocably. Ward 5B was able to close in 2003. The development of the antiretroviral therapy in 96 was, according to Dr. Volberding, was one of the biggest medical advancements of our lifetime. I'm going to need everybody to go watch the documentary 5B now. It is very easy to access online. Out of the stories that I've told on this channel so far, this one was the most emotional to research. I was met with more anger, sadness, and just devastation than I was expecting. But learning about the courageous, fearless nurses that form 5B gives me hope. There are many issues plaguing the world, and there's so many villains. But there's good people too. And those are the ones that I want to celebrate. We can't forget about the horrors that took place in the 80s and 90s to the gay community. We can't forget the thousands and thousands that had painful, breathless deaths. And we can't forget about the wonderful people that offered them compassion and held their hands until the moment they passed. I'm glad that I know more about this now. I feel like I can better understand the people in my own life that have lived through it. All of the searches I used for the research are listed down below. HIV.gov has a great timeline of events and is super easy to understand and use. NPR's podcast Fresh Air has an episode interviewing Cliff Morrison and Dr. Volberding following the release of the documentary 5B. Let me know your thoughts and further insights. I hope you enjoyed learning with me today, and thanks for watching. I'll see you again soon.